Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist working in UK. And this morning I've got Dr. Bilal with me, and this session is especially for the IMG dentists. And I was getting a lot of requests, people asking me to do something for the dentist because they want to understand that as a internationally qualified dentist, how can you come and work in UK? So we are very thankful for Dr. Bilal for giving us the time, and I found him very useful that he was willing to share information and his own journey. So at the very short, we will. Dr. Bilal is a dentist from Pakistan who came to UK in 2017 and now working in UK as a dentist. And we will talk about his journey briefly. Then we will also talk about the GDC, the General Dental Council registration, the exam, the licensing process, and how to sort of find the first job and what kind of opportunities are available for the dentist. So first of all, Dr. Bilal, thank you very much for joining and giving us your time.
You're welcome.
So Dr. Bilal, can you tell us a bit about your own journey? That how did you come to UK, and what has it been like for you so far?
So I graduated from Pakistan in Faisalabad Punjab Medical College in 2013, and then I finished my house job in 2014. And after that, I worked in Pakistan for 2-3 years, and I got married in UK. So my spouse was British national. So and the process, I started the process of the exam in the UK in 2015. I applied in GDC for a registration to approve my eligibility for exam. And then I came in UK in 2017, and I passed my part one, ORE part one in 2018 August, and then part two in 2019 January. And I got my full registration in April 2019. After that, I started working in a primary care. After passing your GDC exam, ORE exam, you have two options, whether to work as a general dentist, or you can go in a hospital. So if you're working as a general dentist with NHS, then you have to get the NHS performer number. So for NHS performer number for overseas dentists, they have a scheme which is called PLVE, is performance list validation by equivalence. So you have to do that for 1 year. I did that for 1 year. Then I worked in a general practice for 1 more year. And at the time, I'm doing dental core training in specialty dentistry, and I'm starting my dental core training year two, in September in Southampton General in oral and maxillofacial surgery.
So thank you for sharing that. The question people will ask is that what is the process? If you have done dental qualification in back home in an international country, what is the process of registering with GDC?
Process of registration with the GDC, I will just divide in 2 steps to make it a bit simpler. At first, you have to apply in a GDC, and you have to prove your eligibility. And GDC has to accept your application and make you eligible for exam. So once you become eligible to give an exam, then you can book your exam. So there will be 2 parts of the exam which GDC takes is ORE, Overseas Registration Exam, Part 1 and Part 2. There is another exam as well, which is taken by Royal College of Surgeons. It's called LDS. It's called Licensing in Dental Surgery. That also has 2 parts, Part 1 and Part 2, and procedure is almost the same with slight differences. I don't know much of the LDS thing is because I haven't done that personally, but some of my friends have done. So I know just a few bits of that, but I will be focusing more on ORE because it's slightly easier to get the slot and slightly easier procedure if you are fresh graduate and you have a good knowledge of your theoretical or basic sciences, because in LDS they don't ask about the basic sciences, more about clinical sciences and practical. So for the first step, I would say you have to register with the GDC. So if you go onto the GDC website and you just show your interest, that you are interested in getting a license to work in the UK, so they will start asking you a few questions, and after answering those questions, very simple and straightforward, that from where you have graduated and when you have graduated, and do you want to work as a hygienist or a dentist, or when do you want to appear, and things like that, they will send you a customized application form which is quite similar for the people who are graduated from overseas. So you have to fill that customized form, and there will be few documents you have to attach with. If you have done graduation which was taught in English less than 2 years ago, then you can use that as your competence of competency of English. Otherwise, if you have done your graduation in a language other than English, or if you have done it more than 2 years ago, then you have to do an IELTS exam. They only are accepting IELTS exam. I don't think so at the moment they are accepting any other exam. So for IELTS, the requirement is you have to do 6.5 in each module, and it should not be more less than 7 overall. So it should be more than 6.5 in each of the 4 modules, and more than 7 or more than 7 overall. Another document you will need is NARIC. Now they have changed the name of NARIC. I think it's now ECCTE or something like that. But even if you write NARIC equivalent certificate on Google, they will lead you towards the new department they have made. So you have to apply for the equivalence of your degree. They will ask you for a few of the documents, and they will give you a certificate of comparability, which proves that your degree which you have done is equal to the degree of the UK. The third important document you have to provide is the certificate of good standing from dental council of your own country. Another document which you will need is the clinical reference. Clinical reference will be given by any of the deans, head of the departments, head of the institute, which clearly states that this candidate has performed work on the dental chair with patients for more than 1600 hours. So you can include your undergraduate training into the clinics, or postgraduate training in the clinics where you have worked with the patients, and to make this 1600 hours complete. And there are very few other documents which I would say we will just count on them. Is one of the character references, really easy one. You can get it signed from any of the lawyer from your own country, or maybe any of the professionals. They will also tell you and who can sign that character reference. Then you will need your passport. If you have your name get changed, then you have to provide the evidence for that your name has been changed. And another one is I think you will need a few of the photographs. So these are the documents. When you will compile them all and you will send them to GDC, they will take 4 weeks. And those 4 weeks, they will contact with your character reference, referee, and clinical referee to confirm that what they are saying in the application form is right. So when they respond that this is right, and they think that they don't need any of the document, they just approve your application, and they give you a EGDC account. Is a General Dental Council account, and through that account you book for before exam, you book your exam, and after passing the exam, it's everything to do with your indemnity, upload your CPDs and everything you have to do from that. So once you become eligible to book an exam, then you have to book an exam. So now I'm just going towards exam itself. So
before going for the exam, you mentioned this 1600 hours. I think is good to clarify. Do you need to keep a logbook, or is it just a doctor confirming?
It's just a simple paper in which someone who has supervised you directly or indirectly that this person has worked for 1600 hours. So there's no logbook.
Okay.
So you don't need any logbook. So if anyone can certify that you have worked, then they usually accept that.
Okay, thank you. Great. So I mean, you're going to tell us about the exam, which is a very important part. That how difficult are they? Are they practical, or are they MCQs?
So usually they tell the dates of the exam in advance, maybe 1-2 years in advance. So usually ORE part 1 happens twice a year, and the part 2 they usually conduct 3 times in a year. So 6 to 7 weeks before exam, they open a booking, and 4 to 5 weeks before booking, they will send you an email, and they will tell you that what time and what date they will open the booking. So at that time, you have to log into the EGDC account with your credit or debit card from whichever you are paying the payment details. And as soon as the booking opens, you have to book your exam. So there are a lot of stories that the people are unable to secure the seats. So it depends on your luck. It depends on your internet connection, and how quickly you have clicked that button to book the exam. So they will just accept 200 applications for part one. It's only first come first serve basis. So whose ever request will reach to the GDC first, in those first few seconds, they will just give 200 seats to them, and after that, they will close the panel portal. After that, you have to make the payment, and once the payment is made, they will send you an email that your seat is secured and you have to appear in the exam in such and such date. If you are in the UK, then it's fine. Otherwise, at that point, you have to apply for your visa as well. So you can come on a visit visa
Hmm.
to give your exam. If you're already in the UK, then you don't need to think about that, and you have to start preparing. You must have been preparing before the booking, and then you get like 6 to 7 weeks to revise everything, and then you appear in part one. There are few things I want to clear before going forward. That for once you appear in part one, you have 5 years to complete both part one and part two. It doesn't matter if you clear your part one in first attempt or second attempt. So within 5 years window, you have to finish your ORE exam. Otherwise, you will no longer be eligible to appear in ORE exam. And again, and also they give you 4 attempts. So they will give you 4 attempts for part one. If you couldn't make it in 4 attempts, then you become uneligible. And also 4 attempts for part two. So if you couldn't clear the exams within 5 years with having 4 attempts of each exam, then you have to think for some other exams, maybe LDS or working something else.
Hmm.
So coming towards the details of part one now. In part one, it's they have two kind of questions: MCQs, which is multiple choice questions, and EMQs is extended match questions. In MCQs, they will give you a statement, and there will be 4 or 5 options. You have to select only one. And extended match question is slightly different kind of questions. I didn't come across these questions before I came for this exam. So it's like they give you the options first, like they will give you 7 or 8 of the options and then give you 3 or 4 statements. So you have to pick one of the options and you have to bring it in front of the statement. So you have to like match those statements with the options. And exam usually is conducted only in UK, only in London. There is only one center, guys, hospital. So they just conduct exam in UK. You cannot appear in this exam in any other country. In part one, there are 2 papers, paper A and paper B. Usually, it's said that in paper A, they usually ask about the basic sciences, more of the basic sciences like anatomy, physiology, general pathology. And in paper B, they usually ask about the clinical subjects, but it can be otherwise as well. Not set pattern that they have to ask on certain kind of questions in each of the paper. The information which I'm giving you, it's all available on General Dental Council websites. They have given all the
Hmm.
details of these things which I'm just explaining. Usually in one paper, there are 200 questions. So
Hmm.
200 questions in paper A and 200 questions in paper B, and almost 120 screens. So
Hmm.
it will be online paper, online. They will just give you login details of one of the computers in their examination hall, and you have to go there and log in. So why to 120 screens or 200 questions is because some of the questions will be MCQs. So it will be one question per one screen, but some of the EMQs will be more than one question on one
Hmm.
screen. So it's usually the 100 to 120 screens with 200 questions, and you have 3 hours to complete that exam. So they usually on 2 days, 2 consecutive days. There is no gap between the days, but there are two batches of that. So for example, if um, the 100 people will give exam on first batch. So for example, if they are giving exam on the 31st of August and the 31st of July and the 1st of August, the second batch will appear on the 2nd of August and the 3rd of August. So there will be 2 consecutive days.
Okay.
The 50% is the passing mark. You have to get 50% marks in each of the exams. So in paper A, you have to get 50%, and paper B, you have to get 50%. So if you get those 50% after 3 to 4 weeks, they announce the results and they give you an email that congratulations, you have passed your exam and you are now can book your next available part 2 examination.
Hmm.
Do you have any questions so far?
No,
Do you
I
think
was
I
gonna
missed?
I to ask you about. I think people will be interested in knowing the fee and all that. I think as you said, this information will already be available on the website, and what is the
Hmm.
fees. But when you are actually reading for the exams, are there any materials or courses or anything that is already available? You don't need to name any courses, but I just people might need to understand, because
Generally speaking, for part one, you
yeah,
don't need any courses.
mm,
If you have anyone to take some guidance from, people usually charge for that as well. They usually just make 1 or 2 study days. There are few academies. If you
yeah,
can just go to them. I didn't personally, I didn't take any course for part one. So you generally, if you are recent graduate, then you don't generally need
mm,
any kind of courses for part one. But for part two, which I will be coming next in the next section, you will
yeah,
need few courses.
okay,
For part one, as far as the fee is concerned, is £806.
okay,
£806 you have to submit to the GDC, and all the other expenses of traveling, you have to figure that out as well.
mm,
So at the end, I don't want to put people off by telling all the expenses at the beginning. So I will just tell all the expenses and rough how much I spent and
mm,
how much a person should be thinking if they are coming from another country to attempt an exam,
mm,
in terms of money, that how much money they will be spending. So I will be just coming at the end of the exam
okay,
itself. So once you are you have passed your part one exam, then you have to apply for your part two. And same happens 3 to 4 weeks before booking. They send you an email that they're opening a booking on a certain date, certain time. You have to log in and you have to book your exam. You have to pay your fee, and a fee for the part two is almost £3,000. It's £2,929. So £2,929. So
mm,
it's almost £3,000. So this is the only fee which GDC will be taking from you to take an exam. They usually have 144 slots. So 144 slots will be divided into certain batches afterwards. So after booking of the exam, you again have 6 to 7 weeks to just finish your preparation, and then you have to prepare an exam.
mm,
In ORE Part 2, there are 4 sections. The first section is OSCEs. I think it's called Observed Structured Clinical Assessment, something like evaluation. So OSCEs will be the first exam. They usually ask you about, I think, 24 OSCEs. And those OSCEs could be actor OSCEs, in which you have to speak with the actor in the presence of examiners. Examiner itself can be an actor, where they will give you a clinical scenario and they will ask you to do or perform something. The OSCE can be written, in which they might ask you to report a radiograph, to write a referral letter, to write a response to the complaint. It could be anything like that. Or it could be a skilled OSCE, in which they might ask you to wash your hands, how to suture, how to put a rubber dam on, is one of the clinical procedure which dentists usually do. So I'm just giving you a rough idea that they can just ask you any of the OSCEs
mm,
uh, from uh, from any of the general procedures which usually dentists do.
mm,
So you will be aware of those. If you have worked within surgery for 1600 hours, you will be aware of all of the problems and situations which they can ask.
mm,
The second option is the second part of the section of part two is diagnosis and treatment planning. So diagnosis and treatment planning is like they will give you 1 hour and you have to go through the scenario. So it will be like complete history and examination, history, and then there will be investigations. They will give you the results of the
mm,
investigations, and these all details are available on GDC website as well. And then you have to make a treatment plan, and then you have to present that treatment plan to the patient. Almost takes 1 hour exam. And the third part is dental mannequin. Dental mannequin is like there's a fake heads with the teeth in them, and you have to perform few exercises which dentists generally do. So they have given the list of the exercises on a GDC website. So there are almost, I think, 15 to 20 exercises which you have to practice before exam, and then on the exam you have been asked to perform any 3 of them. They will ask you which to perform, which exercise. They will tell you
mm,
that you have to perform these 3 exercises. And then the fourth part is medical emergencies. Quite quick exam, just 15 minutes, and they will ask you about 2 3 medical emergencies. They will ask you any of the associated questions. and then you have to perform BLS. So this is part
Okay.
two. So for part two, I would say if you do not have worked on a dental patient too much in practically in terms of cavity preparations or crown preparations or things like that, then you have to take some courses just to find your skills. And then you have to buy all the stuff yourself, all that mannequin and all the instruments and place it at home. And you have to spend good 2-3 months practicing those exercises for exam. For that, I would recommend that you will need a course for dental mannequin because it's something that
Mm.
you need to see someone doing that how they are doing something, and then you have to copy them and perform the way you should be performing in the exam. For the other three parts, I would recommend maybe not full-fledged exam. You can just take few of the online courses. There are many online courses available for DTPs, OSCEs, and medical emergencies. But if you want, there are academies that
Mm.
perform like all in one. So
Mm.
they call you for 10-15 days and they give you all the courses in that time, and then you are free
Mm.
to go home and just start practicing.
Okay. So thank you for this. I think this is a very good list of information around the exam itself. But when you pass the exam, then you get the GDC license. Is that right? And then what happens after that? I think you were already mentioning that there are different routes after that that you take.
Yeah. So once you have got your, so after passing your part two, you have to apply for GDC registration. They have only, you will need a good certificate of good standing again at this time,
Mm.
because certificate of good standing is only valid for 3 months. You have to get a new one, and they might
Mm.
ask you to do an IELTS as well if it's expired,
Yeah.
or sometimes they accept the expired one as well. So once you get your GDC registration, it takes like 2 to 3 months
Mm.
to get your GDC registration. Then you have, I would say, three options that how you want to work. So you can work as a general dentist, private.
Mm.
So for that, you don't need any training. You just need a job. So if you don't have much of the experience in UK as a dentist, it's very difficult to get a job as a private dentist because the patients in private dentistry is more demanding. The skills they demand more skills from the clinicians as compared to the NHS surgery, because NHS dentistry is very simple, not complex. There are not many complex procedures which
Mm.
and NHS is providing to the patients. So first is you can work as a general dentist
Mm.
as a private. So you don't need any kind of training from NHS for that or any performer. Or if you want to work with NHS as a general dentist, then you have to get a performer number. Then in UK, there are few areas like Southwest, then South, Thames Valley. There are deaneries. So there are few deaneries in England, and there's a deanery in Scotland and deanery in Northern Ireland. So you have to get a job first in a practice, which allows you to perform a NHS training for 1 year, almost 1 year. They usually name the name. They usually name their training as PLVE. I mentioned in before as well. So it's performance list validation by experience. So if the dental practice is approved from the deanery to provide PLVE, then they can give you a job,
Mm.
and then they will sign a contract with you, and you will be working in that practice for almost 1 year
Okay.
under the supervision of one of the mentors. So at that point, you will be applying to the deanery and telling them that I have got job in that practice. Can you please just process my paperwork? So they usually take 12 weeks to process your paperwork. And at the same time, you have to apply with NHS. And you have to tell NHS as well that I have got job in that deanery, and can you please process my paperwork? So there are two forms. They will send you two forms, the big forms. You have to fill in all of your details, and then they will process your application. So after the process of your application, the deanery will send a recommendation to NHS that we have assessed the person's CV, and they have certain deficiencies, that they have not shown that they have enough competency
Mm.
in certain treatments like root canal treatments or crown preparation. So they send the recommendations. NHS put some conditions on the clinicians. They put some conditions. They say that in the 12 years time, you have to perform certain number of cases. You have to keep a logbook. You have to do certain kind of reflections.
Mm.
You have to uh, uh, do certain kind of courses. The deanery itself run courses as well. So you have to do few of the deanery approved courses, do certain reflections, and you build your portfolio for 1 year. So at like 10 after 10 months or 11 months, you have to submit your portfolio to the deanery, and then you have to submit your portfolio to NHS. And then NHS usually meets every month. In some of the areas, they meet like every 2 months or 3 months. So whenever the next meeting of NHS will be, they will
mm,
assess your portfolio, and if they are satisfied, they will lift all the conditions and they will give you a proper performer number without any conditions. So now you are eligible to work as an NHS general dentist without a mentor.
mm.
So then if you have a longer contract with the same practice, you might need to work with the same practice for some years, or you can just resign from there and you can start working somewhere else. So this was the second option of the three, which I just mentioned in the beginning. So now you can work as a general dentist. You can,
Mm.
if you want, you can go to the university, just start your PG certificate, PG diplomas, your masters, any post graduation. You have to pay private, and you can do whatever you want, whichever your special interest is. You start
Mm.
building your skills in that.
Okay.
Just to add in that, if you're working as an NHS, you can work as a private, so you can work mixed. So there's
Okay.
nothing like this. You have to work only NHS.
Mm.
So the private dentist who does not have a performer number cannot work with NHS, but the
Mm.
NHS dentist who has a performer number can work as a private as well.
Okay. And what about are there any routes for the, like, going through further training, like after getting license with the General Dental Council, to actually, is there any, like in medicine we have like specialist training happening in hospital, in this big university hospital. Is there any more training happening that people can join and get paid for as well, and don't have to
Yeah,
pay
yeah.
for
This
it?
is this is the third option, which I
Okay.
was going to explain now. This is the
Okay.
third option, that once you have got your performer number, or even
Okay.
before performer number,
Mm.
you can apply with Cope Dent. Is one of the institutes looks after the postgraduate dental training in UK. Uh, you usually apply through Oriel. I think medicine
Yeah.
people do the same. So they
Yeah.
apply through Oriel, and they can go for a dental core training.
Mm.
So dental core training can be in any of the specialties. There are like 12 to 13 specialties of dentistry. So it could be in any of the specialties, whatever you choose. So you apply through Oriel. Usually for the dental core training part one, they open applications in January, and there is a deadline of February. Then in March there is a situational judgment test, and then in April or May there is an interview. And if you're successful, they will ask you for your preferences, and then they will tell you that you have scored that much, and now this is the position we can give you. This is what I am doing at the time. So I am doing my dental core training part one.
Mm.
So then you just go there, you join, you get paid, you do your then also they give you portfolio to fill.
Mm.
And at the end of the year there is a
Mm.
FRCP, is like some panel meeting. They hold the
Mm.
meeting at the end, and they give you the outcome that you have performed well, not well, whatever. And
Okay.
then you have an option of going towards DCT2, so dental core training part 2. So again, for dental core training part 2, you will be applying in January again
Mm.
while doing your DCT1. So you will be only it's 4 to 5 months into dental core training that the
Mm.
procedure of your dental core training 2 will be started.
Mm.
So again, before the like in June, you will again be knowing that whether you have got the dental core training 2. So I have
Mm.
got my dental core training 2 as well. So in September, when
Mm.
my dental core training part 1 will finish, so I know where I'm going next. So
Mm.
they just tell you 3 4 months in advance that what will be,
Mm.
if you are successful, that what your next position will be.
Okay.
If someone has performed 2 years of dental core training 1 and 2, they become eligible to apply for specialty training, which we call ST.
Yeah.
There is a dental core training part year 3 as well, but that's optional. So
Mm.
it's a choice. If you want to go with that and you want to build a more portfolio, you want to build some more competencies to strengthen your application, you can just go for the DCT about year 3 as well. But after year 2, you become eligible to apply for specialty training.
Mm.
I have not been through that process yet, but I just know maybe one or two people who are overseas graduate who have been through that procedure. It's very, very rare, unfortunately, for an overseas dentist to go through the process because it's very competitive and there are hundreds of applicants and only maybe 10 or 20 seats in every specialty. So it's very competitive.
Mm.
And most of the times even they do not call you for interview. So if your CV is not really strong and you have not performed really well in DCT part 1 and 2, they might not call you for interview for ST. But if you become lucky, then you get specialty training, and specialty training varies from 3 years to 5 years. In some of the specialties, there's only specialists, there are no consultants. So in that specialty, you will be given 3 years of specialty training, and at the end of the specialty training, you will be given that certificate of completion of training, something CCST, I think.
Okay.
Certificate of completion of specialty training, yeah, CCST. They will give you that, and you can register with the GDC as a specialist.
Okay.
And now you can work with NHS as a specialist. If you are lucky enough and you get the last 2 years, like 4th and 5th year of ST training, then you end up being consultant. So you can work with the NHS as a consultant after completing your specialty training. There is one other pathway as well, which is ACF, Academic Clinical Fellowship. So it's quite similar to the DCT one, that there is a core training of part 1 and part 2, and then you have to apply for ACF ST, like some academic clinical fellow. That more of the more on the academic sides, more onto the research. Sometimes they demand you to have a PhD before going to that specialty training. Then you have to complete your PhD first. But I really don't know much information about that.
Okay. No, I think that's great. I think we've given a lot of good information, which is quite useful for the dentist. I think the other thing you mentioned, there is a Royal College exam as well. So that exam is actually, if you pass that exam, can you get licensing based on that as well? Is that what you were saying initially?
Yes. So in terms of exam, the LDS exam, which is taken by Royal College of Surgeons, is slightly stronger because they then after an exam they hold something called that degree awarding ceremony.
Yeah.
And they just award you a degree, and you can write with your name that you have done LDS. Like you can write your name and then BDS and LDS. But ORE is not a qualification. So it's just an exam. So you can't write with your name that you have done ORE. So, but LDS, yeah, it's quite similar exam. Same as ORE part 1 is same, like two papers, and then part 2 is almost the same. The sections are the same, but the distribution is slightly different.
Okay. All right. And I think you mentioned about a lot of people might be put off by the amount of money that you have to spend, but there is some money involved, including the exam fees and the courses. And if you are already, as you mentioned, if you're already abroad to coming to UK to do these exams, so both ORE part 1 and part 2 are happening in UK. You have to be in UK for that. You can't take them out abroad. Okay.
Yeah. So you have to be in UK.
Yeah.
Rough estimate, I would say, if someone passed their exams living in the UK in first attempts, then it will be around £8,000.
Yeah.
They should be thinking about. And if someone is coming abroad, then I would say maybe £10,000. So just £2,000 extra bit for hotel expenses and for traveling costs and things.
Okay.
So it's £8,000 to £10,000 you have to spend at least if you are passing those exams in first attempt. If you couldn't, then you just add up the examination fee, your traveling cost into that cost.
And if somebody is at a stage of a medical student or dental student, they are still in their home country studying right now, or they are just young doctors just giving their final year of BDS exams, what can they do to improve their chances? Is there anything you will recommend to them they should be doing?
No, I would say just focus on their study there, what they're doing. Just focus on that at this time. And there is a recommended books list on to the GDC website. So like for every subject, they have recommended one book, 1 or 2 books. So, examination system in different countries is different. Like in our country, they usually do not recommend the books which the dentists usually study in UK. They usually prefer the American books.
Yeah.
So if you can try and maybe just go through those books which GDC usually recommends for exam, it might be slightly beneficial.
Okay.
But the exam is very basic.
Mm.
Especially the part one is very basic exam. If someone has, passed from one of the good institutes, the chances of passing the part one is quite high.
Mm.
In part two, it's more of the clinical skills. So if you are sitting home and doing practice for 2 to 3 months,
Mm.
it's just like skills. You just start building up those skills, and then after 2 to 3 months, you just prepare yourself.
Okay.
At the time, I would say just focus on your studies. What you are doing, just try to do best in that.
No, no, thank you very much for joining me and giving me the time and all the information. I think it will be very useful for us, the IMD dentists, especially the
Mm,
ones who are thinking about UK. And as you said, a lot of these things needs to be planned in advance as well. So, and the other thing I'll advise to a lot of people, IMGs, and sometimes this process when we talk about, they look quite complex, but everything starts with
mm,
the first step. When you start taking the first step, second step, third step, then eventually you will get to the end. But you have to start from
mm.
somewhere.
Yeah.
So
So
thank
the one
yeah.
last thing I will just mention is there is a slight chances that you can get a job in the UK without a GDC registration.
Yeah.
So this is one of the ways which many people don't know,
Mm.
that even in dental core training there are few of the slots which accepts temporary registrants.
Mm.
So what temporary registrants means, that if you are living abroad and you apply for the job and you become successful, you have satisfied the panel and you got that job, then GDC has to give you a temporary registration for that period of time. So if you get any of the SHO jobs and you become successful, then GDC will give you a temporary registration, but that temporary registration will only last up to that time. So when your job will finish, your contract of 1 year, 2 years will finish, your registration will be finished as well. And that temporary registration will not be, transformed into a proper registration, a full registration, without doing either ORE exam or LDS exam.
Okay. That's fine. No, thank you for all the information. I think it will be very useful.
You're welcome.